Do you frequently feel like your heart aches sometimes? Or maybe you're always tired, even after a full night's sleep. What if it's not your heart or laziness, but your blood? Let's talk about chronic myeloid leukemia, CML. It's a type of cancer that starts in the bone, where your blood is made. Instead of healthy blood cells, your body makes too many white blood cells, like a factory making only one product non-stop and ignoring the rest. At first, you might not notice much, but over time, this overproduction causes problems. Think of it like a traffic jam in your bloodstream. Too many white blood cells block space for red blood cells and platelets, making you weak, breathless, or bruise easily. So what causes CML? It's not from germs or bad food. It starts with a tiny mistake in your DNA, a mix-up between two chromosomes, your body's instruction books. Chromosome 9 and 22 swap pieces and create something called the Philadelphia chromosome. This creates a broken gene called BCRABL, which acts like a stuck-on switch, telling your bone to make too many white blood cells. It's like if your faucet got jammed and kept pouring water non-stop. Nobody gives you CML. It happens by random chance, often in adults over 50. It's not contagious, so you can't catch it from someone else, like a cold. Do you often feel bloated or full quickly when eating? That could be a clue. CML signs start slow. You might feel tired, like you haven't slept in days, lose weight without trying, sweat a lot at night, soaking your pajamas, or feel pain under your left rib, where your spleen is. Your spleen gets swollen from all the extra blood cells, like a balloon filling with air. Some people notice small red spots on their skin, easy bruising, or even bone pain. But here's the thing. In early stages, many people feel almost normal. That's why it's sneaky. It hides in plain sight until a routine blood test catches it. First, a blood test, like checking oil in a car. If your white blood cell count is super high, they will investigate more. Then, they take a small sample from your bone, usually the hip, in a procedure called a bone marrow biopsy. It sounds scary, but they numb the area like a dentist. The real test: looking for the Philadelphia chromosome under a microscope or using genetic tests. Once confirmed, treatment often starts with targeted therapy, pills like imatinib, Gleevec. These meds are like smart missiles. They find and shut down the broken BCRABL switch. Most people respond well and live normal lives, with regular checkups and blood tests. In rare cases, if pills don't work, a bone marrow transplant might help, a reset button for your blood system. Can you prevent CML? Sadly, not really. Since it's caused by random DNA changes, not lifestyle or habits, there's no surefire way to stop it. You can't vaccinate against it or avoid it by eating broccoli, though that's still good for you. However, catching it early makes a big difference. So if you're over 40 and feel unusually tired, losing weight, or have belly fullness, don't ignore it. A simple blood test could help. Think of it like checking your car engine light early. Fix it now, avoid a breakdown later. Living healthy, no smoking, low stress, good sleep, won't prevent CML, but it helps your body fight better if you ever need to. Good news, science is moving fast. While imatinib changed everything in the 2000s, newer drugs like dasatinib, nilotinib, and ponatinib now help people who don't respond to first treatment. And here's something exciting. Researchers are exploring treatment-free remission, meaning some patients can safely stop pills after years of success if their cancer stays undetectable. Imagine being cancer-free without daily meds. Also, scientists are testing vaccines and immune therapies to train the body to fight CML. It's still early, but hope is growing. For patients, this means more freedom and better quality of life.